Someone was taking a video of the Washington Monument from the Lincoln Memorial when they saw a lightning bolt hit the top of the monument. Officials who
Dr. Fauci, we don't know whether the pandemic started in a lab in Wuhan or evolved naturally, but we should want to know. 3 million people have died from this pandemic, and that should cause us to explore all possibilities. Instead, government authorities, self-interested in continuing gain-of-function research, say there's nothing to see here. Gain-of-function research, as you know, is juicing up naturally occurring animal viruses to infect humans. To arrive at the truth, the U.S. government should admit that the Wuhan Virology Institute was experimenting to enhance the coronavirus's ability to infect humans. Juicing up superviruses is not new. Scientists in the U.S. have long known how to mutate animal viruses to infect humans. For years, Dr. Ralph Baric, a virologist in the U.S., has been collaborating with Dr. Shi Zhengli of the Wuhan Virology Institute, sharing his discoveries about how to create superviruses. This gain-of-function research has been funded by the NIH. The collaboration between the U.S. and the Wuhan Virology Institute continues. Doctors Baric and Shi work together to insert bat virus spike protein into the backbone of the deadly SARS virus, and then use this man-made supervirus to infect human airway cells. Think about that for a moment. The SARS virus had a 15% mortality. We're fighting a pandemic that has about a 1% mortality. Can you imagine if a SARS virus that's been juiced up and had viral proteins added to it, to the spike protein, if that were released accidentally? Dr. Fauci, do you still support funding of the NIH funding of the lab in Wuhan?
Senator Paul, with all due respect, you are entirely and completely incorrect that the NIH has not ever and does not now fund gain-of-function research in the Wuhan Institute
Do they fund
of Virology.
Dr. Baric?
We do not fund.
Do you fund Dr. Baric's gain-of-function research?
Dr. Barrett does not doing gain-of-function research, and if it is, it's according to the guidelines, and it is being conducted in North Carolina.
You don't think inserting
in
a bat virus spike protein that he got from the Wuhan Institute into the SARS virus is gain of function?
That is
You would
not
be in the minority because at least 200 scientists have signed a statement from the Cambridge Working Group saying that it is gain of function.
Well, it is not. And if you look at the grant and you look at the progress reports, it is not gain of function, despite the fact that people tweet that.
So do you still support sending money to the Wuhan Virology Institute?
We do not send money now to the Wuhan Virology Institute.
Do you support sending money? We did, under your tutelage. We were sending it through EcoHealth. It was a sub-agency and a sub-grant. Do you support the money from NIH that was going to the Wuhan Institute?
Let me explain to you why that was done. The SARS-CoV-1 originated in bats in China. It would have been irresponsible of us if we did not investigate the bat viruses and the serology to see who might have been infected.
Or perhaps it would be
China.
irresponsible to send it to the Chinese government that we may not be able to trust with this knowledge and with this incredibly dangerous viruses. Government scientists like yourself who favor gain-of-function research.
I don't favor gain-of-function research in China. You are saying things that are not correct.
Government defenders of gain-of-function, such as yourself, say that COVID-19 mutations were random and not designed by man. But interestingly, the technique that Dr. Baric developed forces mutations by serial passage through cell culture that the mutations appear to be natural. In fact, Dr. Baric named the technique the no-see-em technique because the mutations appear naturally. Nicholas Baker of the New York Magazine said nobody would know if the virus had been fabricated in a laboratory or grown in nature. Government authorities in the U.S., including yourself, unequivocally deny that COVID-19 could have escaped a lab. But even Dr. Shi in Wuhan wasn't so sure. According to Nicholas Baker, Dr. Shi wondered, could this new virus have come from her own laboratory? She checked her records frantically and found no matches. That really took a load off my mind, she said. I had not slept for days. The director of the gain of function research in Wuhan couldn't sleep because she was terrified that it might be in her lab. Dr. Barrick, an advocate of gain of function research, admits the main problem that the Institute of Virology has is the outbreak occurred in close proximity. What are the odds? Barrick responded, could you rule out a laboratory escape? The answer in this case is probably not. Will you, in front of this group, categorically say that the COVID-19 could not have occurred through serial passage in a laboratory?
I do not have any accounting of what the Chinese may have done, and I'm fully in favor of any further investigation of what went on in China. However, I will repeat again, the NIH and NIAID categorically has not funded gain-of-function research to be conducted in the Wuhan Institute of Virology.
You support it in the U.S. We have 11 labs doing it, and you have allowed it here. We have a committee to do it, but the committee has granted every exemption. You're fooling with Mother Nature here. You're allowing super viruses to be created with a 15% mortality. It's very dangerous. I think it was a huge mistake to share this with China, and it's a huge mistake to allow this to continue in the United States. And we should be very careful to investigate where this virus came from.
I fully agree that you should investigate where the virus came from. But again, we have not funded gain-of-function research on this virus in the Wuhan Institute of Virology, no matter how many times you say it,
there was research. There was research done with Dr. Shi and Dr. Barrick. They have collaborated on gain-of-function research where they enhanced the SARS virus to infect human airway cells, and they did it by merging a new spike protein on it. That is gain-of-function. That was joint research between the Wuhan Institute and Dr. Barrick. You can't deny it.
Senator Paul, your time has expired. Dr. Fauci, I will let you respond to that when we need to move on.
Excuse me?
I will allow you to respond to that, and then we'll move on.
Yeah, I mean, I just wanted to say, I don't know how many times I can say it, Madam Chair. We did not fund gain-of-function research to be conducted in the Wuhan Institute of Virology.
Thank you. Senator Smith. Thank you. Senator Cassidy.
Thank you. Let me just follow up right there, Ms. Arthur. You allude to it in your testimony, and going back to what Chairman Ranking Member Burr said earlier, Congress gave $1 billion to CDC to upgrade information systems. And I was specifically asking last year for more money for immunization information systems, and was told that billion was going out to states in order to upgrade, that's where it was targeted, because I was frustrated with CDC's inability to give real-time data. Now, so it seems as if we're advocating for dollars, of which $1 billion has already been appropriated, and we're told this is where it went. But Mr. Becker, in your testimony, you indicate that in Washington State there has been inadequate money to upgrade the immunization information system. I say that because it seems like there's a disconnect here. We gave $1 billion. I was specifically told it's going to go to upgrade state information systems, and I'm hearing from a very innovative state that you have inadequate resources to upgrade. So let me ask, did you receive money from that $1 billion that we gave CDC last year?
Thank you, Senator. I will have to go back and find out how much Washington State actually received from the CDC, but I can tell you that whatever we received was not adequate to meet the needs of what we have faced today.
Now, it could be that the state used it for something else. Let's just be fair to CDC, unless they came down with a specific instruction to spend it on immunization information systems. But it does seem, let me just ask, in your testimony, you do mention that you had a hard time keeping track. But this is exactly what immunization information systems are supposed to do. Why was Washington State's not adequate to do so?
So thank you, Senator. It's just the scalability, interoperability that I mentioned in the very first part.
But in the interoperability, you mentioned about EHRs. But the way if a child is given a measles, mumps, rubella vaccine, the provider actually enters that. And we've had other states come in here and testify that their IIS is currently accepting adult immunizations on COVID. Now, I guess I'm just exploring. I'm not trying to accuse. I'm just trying to understand why this is not the case why isn't it the case in Washington?
I think it's the disparate system. So you have very big hospital systems that can invest the infrastructure to send those things seamlessly. You have private providers that don't have that
What I'm
access.
unsure about, though, if a pediatrician is sending measles, mumps, rubella in that big hospital system, clearly the mechanism occurs. I won't belabor, but it does seem I'm just not getting a clear picture into what the problem is. We give $1 billion to CDC. Somehow it's not happening, and yet the system works for childhood immunization, but it's not working for adult. I won't belabor. Dr. Jantz, I think one thing is clear. You mentioned in your testimony the need to have uniform standards of care. Fecal material is hitting the fan, and we don't have enough ICU beds. I probably used that line in my diarrhea lecture. We don't have enough ICU beds, but then we learn that we're putting too many people on ventilators. And putting on ventilators at too early a stage actually was associated with negative outcomes. How do we, I have to think that there's probably uneven uptake of that information in ICUs across the nation. I don't know that, I'm just assuming. How do we establish that uniform communication of care when how we manage a ventilator patient to ventilate or not really is critical in terms of both ICU utilization but also the patient's survival?
Yeah, thank you, Senator. It was vital for us to be able to spread evidence-based medicine, how to prevent patients.
How did you do it?
Via the Louisiana Department of Health and the Department of Health and Human Services, when we conducted seminars with hospitals around the state and the nation, where they asked us, how do you solve these specific operational problems? We gave them answers.
Now, were you also able to give them like a checklist?
Yes.
So you were?
Yes, we shared with them all of the materials we developed in our own hospital. We stepped outside of the silo of an individual hospital system and shared all of our...
I don't mean to interrupt, but I'm almost out of time. And you went nationally. Who sponsored your national outreach?
ASPR, with the Department of Health and Human Services.
So hats off to ASPR for pulling that together.
Absolutely.
And were you able to demonstrably see that how patients were being managed kind of stayed in lockstep with best practices across the nation?
Yes, it did catch up over time into what
now, over time, how long over time? A month, a week?
Oh, on the scale of weeks. It was very quick. The feedback I got from hospitals around...
One more thing. We were short. I got a call from an anesthesiologist in San Francisco when things were really bad in New Orleans. He goes, we've shut down electives, but COVID hadn't hit us yet. We should be shipping all our machines to you, and then you ship them back when it hits us. Because we understood there's going to be an uneven kind of implementation on it. Never happened. Instead, we're scrounging to build new ventilators when they were sitting idle in many parts of our nation. I just say that because I do think part of what we're doing here would be to source existing resources where they're needed from one part of the nation to another, as opposed to attempting to build from scratch a lot of machines that are very sophisticated, but then we don't need them when it's all done. So anyway, with that, I thank you all for your service and your testimony.
Thank you. Senator Smith.
Thank you, Chair Murray and Ranking Member Burr. I really appreciate this bipartisan hearing.
60 million people are urged to stay at home.
Now for the less basic parts. This is not the last major outbreak we're ever going to see. There's going to be more outbreaks, and there's going to be more epidemics. That's not a maybe, that's a given. And it's a result of the way that we as human beings are interacting with our planet. Human choices are driving us into a position where we're going to see more outbreaks. But it's also about the way we're pushing into the last wild spaces on our planet.
Boom, you get a viral explosion.
Wearing 2 covert cameras, we went into Chattachak, a labyrinthine maze of alleyways lined by shops selling exotic birds next to poultry, even vultures destined for the cooking pot. Animals from across the continents, some trafficked, some bred.
African grey. I know for a fact that the African greys are smuggled in through southern Thailand.
Meerkats, crammed in, stacked high.
So these are $1,000. Raccoons.
What's this guy down here?
Yep. That's a prairie dog.
She just showed us a bush baby.
Yes, she's connected.
Even though the market had been officially closed during lockdown, about a third of the shops were still trading. We saw tortoises from Africa and India, blue-bearded lizards from Australia, Burmese pythons, and these tiny sugar gliders from New Guinea. In a closed shop, a rare African serval cat.
We gotta go.
Steve Golster, who's been on the case here for years, has been recognised. We move on. What on earth are these?
Biggest rodent in the world, capybara in South America. It's basically the size of a dog, and it's pretty expensive. She just said it's so this is about $3,500.
Thailand's long been a global hub of the international commercial wildlife trafficking industry. It's worth countless billions of dollars a year. And it's in places like this that the next pandemic could start. No wonder campaigners call COVID Mother Nature's revenge. We told Bangkok's top wildlife enforcement official what we'd filmed. He said a stricter new law with harsh penalties was passed just before COVID hit.
นั้นถ้าไม่มีการค้าเนี่ยการควบคุมก็จะง่ายแล้วก็จะปลอดภัยไม่มีการค้าก็แสดงว่าไม่มีอุปสงค์อุปทานในการเชิงพาณิชย์นั้นการบังคับใช้กฎหมายเนี่ยเป็นเรื่องลำบากโดยส่วนตัวผมก็อย่างที่บอกว่าถ้ามันตัดเรื่องการค้าได้เนี่ยทุกอย่างมันจะง่ายขึ้นและดีกับทุกฝ่าย
So a total ban on all wildlife trade is a really simple and powerful message.
Amy Hinsley is part of a group of Oxford University scientists who argue that a blanket ban on the trade on public health grounds wouldn't work.
But the problem with that is the wildlife trade isn't simple. It's an incredibly complex system. It involves thousands of species being traded all over the world for things as diverse as food and medicine and pets. And we have to, I think, move past this idea that there is this one simple solution that can fix this.
Another Oxford researcher received death threats this week after espousing this view in a newspaper.
We need to kind of take an approach that looks more at the situations, so preventing these kind of low welfare, poor hygiene methods of sale, and also avoiding the trade in high-risk species.
What's not in question is that live animal markets mixing species in jam-packed conditions are potentially lethal. After HIV, Ebola, SARS, MERS, bird flu, swine flu, and now COVID-19, this planet needs a solution before the next outbreak hits.
Just say they'll continue to delve deeper to get a better understanding of the universe beyond this planet, saying it all helps answer questions about how we got here. And what's out there.
Our sun is just one among 100 billion stars in the Milky Way, which in turn is one of countless other galaxies in our universe. In this image, the galaxy is in the middle, shooting out either side are jets of material across the expanse of space as a result of a gigantic black hole inside it.
These jets shoot out just like a fountain of water, far, far beyond the reaches of the galaxy itself. I walked around with a huge smile on my face for the rest of the day because I felt so proud that I was able to make this image and be able to see something nobody had ever seen before.
All thanks to a network of 70,000 radio antennae like these spread across 9 European countries. Together they create a lens about the size of the Netherlands.
They may not look like much, but astronomers have connected 52 sites just like this one, spread all across Europe. Astronomers can now see things they've never been able to see before.
Here, because I think that's gotten lost in some of the media noise around COVID-19.
But it's not the first time a disease of this nature has spread across the globe. It comes from a large family of viruses called coronaviruses. Some cause nothing more than a cold.
COVID-19 is known as a novel coronavirus because until December, we'd only heard of 6 coronaviruses. COVID-19 is the 7th. It's new to us. It just had its gene sequencing. It just got its name. That's why it's novel. If you remember SARS, severe acute respiratory syndrome, or MERS, Middle Eastern Respiratory Syndrome, those were coronaviruses. And they're both called respiratory syndromes because that's what coronaviruses do. They go for your lungs. Coronaviruses are zoonotic, which means that they transmit from animals to people. Some coronaviruses, like COVID-19, also transmit person to person. The person-to-person ones travel faster and travel farther, just like COVID-19. Zoonotic illnesses are really hard to get rid of.
Declaring a public health emergency of international concern over the global outbreak of novel coronavirus. The main reason for this declaration is not because of what is happening in China, but because of what is happening in other countries. Our greatest concern is the potential for the virus to spread to countries with weaker health systems.
It's really hard to get a good quarantine in place. It's really hard to set up travel restrictions. Even the countries that have made serious investments in public health, like the US and South Korea, can't get that kind of restriction in place fast enough to actually stop an outbreak instantly. There's logistical reasons for that, and there's medical reasons. If you look at COVID-19, right now, it seems like it could have a period where you're infected and show no symptoms that's as long as 24 days. So people are walking around with this virus showing no signs. They're not going to get quarantined. Nobody knows they need quarantining.